The intervention that we looked at was play. So we are looking at play-based occupational therapy for a pediatric client.
I'm Rachel.
And I'm Amanda.
So our client is a 47-month-old male, so he's almost 4 years old, and this means that he was previously independent with toileting, and because of his condition, he isn't now. Typical play for a 47-month-old really includes complex imaginary play, constructive play, rough and tumble play, and social play. And these are some milestones we want him to get back to performing in. His diagnoses that he has is acute myeloid leukemia, septic shock, and cardiomyopathy.
And as I already said, we are looking at play, which includes play participation and exploration. And then because he is in the hospital setting, commonly you're looking at ADLs as well. And this was what the parents' goals were too, were focused on toileting, functional mobility, and dressing. The two models that we decided to look into and used for this intervention and our sessions were MOHO, which you guys are all familiar with, focuses on volition, habituation, and performance, while working on the areas like routines, roles, and habits. And then the area of MOHO that's unique compared to other models is how MOHO does expand on the client's personal experiences and their own viewpoints of their abilities. With this client specifically, I'm going to dive into volition to try to figure out what really motivates this client, since he often does cry during his sessions. And then the other model we looked at was behavioral activation model, which focuses on enabling individuals with identifying, scheduling, and engaging in therapeutic occupations in client-led interventions that can be repeatable.
And now we're going to show our demonstration.
Okay, so to start off our intervention, we really want to educate our client and his mother about how recovery is not really a straight line. It's going to have uphill battles and really good progression. So there's going to be good days. There's going to be not so good days. And overall with OT, we just want to make sure that we are increasing the performance in what he does in each day with all of those occupations that he engages in.
And so in this instance, we're going to be incorporating behavioral activation, which is including 4 different steps. And we're going to be using these stuffed animals because our client talked about really engaging and enjoying using and playing with stuffed animals. And so these 4 steps of behavioral activation include value identification and goal setting, which is really what our initial evaluation is going to include. Our activity scheduling, which we will go through with scheduling different activities that the client can do throughout the day, and then activity monitoring, which we can do with this sticker chart, and just really kind of record and then have a positive environment for this client to interact within, using this positive reinforcement. And then we're also going to include skills training, which is really our skilled OT intervention that we're including using evidence-based practice.
So as Rachel said, the first step is identification and goal setting. So in this case, it's going to be related to the occupational performance. So we've learned from this client's mom that she really wants to work on some of the ADLs with like functional mobility, dressing, and toileting. So we're going to be incorporating play as a means to achieving some toileting.
So with that, what we'll be doing is really kind of scheduling these activities and occupations that are meaningful to the client throughout the day. So this is going to include what we're working on, which is going to be really toileting in this case, in this scenario. And so we're kind of setting up the scene to facilitate that by using stuffed animals.
And the information that we found about using stuffed animals with clients is that especially like children can associate these, like disassociate their own feelings and putting them into the stuffed animal instead. So it helps them express their feelings, and different animals can have different emotions and different personalities, which really helps them differentiate those. And then with our scenario, like the flamingo is going to be really trying to like encourage the client, and this will help with like the positive reinforcement for toileting through using play.
So what we decided to use is 3 different stuffed animals in the main scene, and then the penguin's going to be out into the bathroom in a location that's going to be sanitary. And so the therapist is really going to enact as 2 different stuffed animals, and you can let the client choose what animal they like to be. So The client chose that they'd like to be a dinosaur, so the therapist will act as the other two, and we'll kind of have a little scene that we're going to play through. So the flamingo might start off saying, "Hey, monkey, let's go meet Penguin in the bathroom. He's been waiting all night for someone to come play with him." And the therapist could then act as the monkey. "I don't really want to. I like to lay him down and relax. Ask Dino instead." And the therapist could then say, "Dino, should we go visit Penguin in the bathroom or have Otis hang out with you on your neck?"
I just want Otis to hang out on my neck. I don't really want to go to the bathroom right now. That sounds like a lot of work. So obviously you can make this scenario a lot longer, but with this time we decided to just end it here. And the reason that we chose between having the client either go to the bathroom or having Otis lay on his neck is because this is actually weighted. So no matter which choice he makes, well, first of all, he can't say no, because he has to choose between the two. And then both choices work on some part of his goals in the end. And then this really incorporates that skills training with our interventions because the evidence fits the client's needs to promote, like I said, either postural stability or going to the restroom independently. And then we're going to be able to use this reward chart to monitor the client's occupational performance and activities using a sticker log. So that's motivating for him to be able to track his progress and like get a toy at the end.
Now we're going to dive into the evidence for this intervention. Brick et al. Discussed how the four main components of behavioral activation really include value identification and goal setting, as well as activity scheduling, activity monitoring, and skills training. So these all can really increase participation in meaningful and purposeful activities. And through our skilled occupational therapy, we can schedule this throughout the day for this client. And because the client has shown interest in stuffed animals since he had a stuffed animal in the first session, we decided to include stuffed animals to ground our intervention in play. And these stuffed animals and a chart to reward the client are both positive reinforcements within the environment.
And then Van Brick et al. Looks at play within children through a qualitative study, which they conducted some semi-structured interviews with therapists working in the hospital setting with clients that have these life-threatening illnesses. And then the 3 interviews that were conducted, the first one being the occupational therapist, just getting to know their background, like where they've worked, like the settings and how long they've worked in them. The second one was telling stories about clients who are experiencing life-threatening illnesses in general. And then the third is going more in depth on one specific client's story and giving a lot of details about that one. The themes, there are a lot, and I'm just going to name a few themes that were identified, but one of them being reimbursement can be very difficult for play interventions. So it is often used as a means, which we're kind of doing in our interventions a little bit too. The general importance of play for children, since it is their main occupation. Challenges with getting clients to play based on their conditions, because they may be very exhausted depending on what their condition is. And then playing just for the sake of play if they're at the end of life. Then the second article that I looked at was by Mohammed Ali. And then this is a single subject design looking into 2 specific therapists and how play interventions can help decrease the discomfort in the hospital settings. These could be things like pain or fatigue and anxiety. And then the beginning of this study included assessments that look at those specific areas, pain, fatigue, and anxiety. And they did find that using play interventions does decrease that discomfort in those settings.
And finally, Coleman et al. Also looked at how occupational therapy can increase participation in play, leisure tasks, and also practicing fine motor skills. And this is all done throughout purposeful activity, ADLs and IADLs, and also improves strength for pediatric clients. And the clientele in this study were individuals that had cancer and also have had hematopoietic cell transplantation, which is a bone marrow transplant. This is pretty similar to our client's diagnosis of AML.
So some clinical reasoning questions. The first one being, how would you change this intervention approach to better fit a different setting? For instance, if you were in an outpatient setting instead of the hospital.
Another one is, how do you think you might feel if you were this client?
Another one would be, how will you ensure that you understand the client's emotions at this time?
And how would you go about changing your intervention on the spot? What if this client's oxygen saturation levels began to drop again?
Thank you for looking at our presentation.